tonight's topic, T, if you want to pop up the image of the talk, this just came up in Human Reproduction, which is one of the premier fertility journals, and it's called The Association Between Miscarriage and Fecundability, the Norwegian Mother, Father, and Child Cohort Study. So everybody knows what a miscarriage is. It's a loss of a pregnancy prior to 22 weeks. But a fecundability, most people will have no idea what that means. So that's your chance of conceiving in any given month. So, most people would say it's 15, 20% per month. Some people will say a little bit more. So, that's the chance. So the question these guys asked is there a relationship between a previous history of miscarriage and your chances of having fertility problems? And does the time to conceive then predict your chances of a miscarriage? So basically, they wanted to know both ways. Does a miscarriage predict fertility problems, and do fertility problems predict miscarriage? So the great thing about the Scandinavian countries is that they have socialized healthcare systems with massive data collection that has gone on for decades and decades. Very, very sophisticated. And so when they want to do these epidemiological studies, they can just kind of take the data, look at it, put it all together in a database, and then say, we want to ask this question. What does this question look like? And, what kind of data can we get, and what kind of information can we get? So in order to do that, these guys basically went ahead and looked through their data set to see how many women had had a miscarriage over a certain time period, and then how long did it take them to get pregnant, and did they then, from the people that did get pregnant, how long from the time that they got pregnant was it to get pregnant, and then how, if it took them a long time, were they at a higher risk of then having a miscarriage once they got pregnant? So kind of an interesting study, a neat way to kind of look at things, a little bit different from what we've seen before. Studies prior to this had looked at whether or not a previous history of miscarriage predicted infertility. And then there were studies that looked at whether your infertility predicted a miscarriage, but no one had done both on the same thing. So if you want to pull up figure one, we'll show you basically their setup. I don't know if you can kind of blow that up full screen or not, T, but we'll have a look at that. So the MOBA pregnancies are all the pregnancies in this specific database that they used. And in total, over the time period, there was 112,694. And it went from 2008, I think, all the way out to 2014. About 10,500 or so were missing info, so they eliminated those. 102,000 finished the first questionnaire. A bunch had either unplanned pregnancies or pregnancies with infertility treatment. They didn't want those patients, so these were only people that were natural. And about 1,900 were missing data on time to pregnancy, which is what that TTP stands for. So they had complete info on 80,000. 27,000 had no prior pregnancies. And then before 2008, there were 67,000 that had had pregnancies. For those that had had at least one prior pregnancy, which they really wanted to focus on, there was 53,000. And then a few more that had these 2008, 2009 pregnancies. So when you scroll down a little bit longer, a little bit further there, T, you get down to the bottom, and in total they had two study populations. Study population number one, 48,537, so still a huge number of people. And study population number two, where they looked at time to pregnancy and miscarriage risk, was just under 8,000 people. Again, that's a huge number of people. So what did they find? What they were looking for was essentially, initially, what's that relationship between a previous miscarriage and your chance of having infertility. So if you go to table 2, I'll show you that. And they have a whole bunch of demographic data, but I won't bore you to tears with that. So Tarek's going to pull up table number 2, and we'll go over that data. So looking at table number 2, which is on the screen now, you can see that if you had never had a miscarriage before, that was 35,000 of the 48,000 people. They had a total number of 125,712 cycles that could potentially lead to conception. 33,000 of those were able to get pregnant within 6 months. And out of those, they were used as the reference category. For the patients that had at least one previous miscarriage, you're now looking at 10,400 women, 41,000 cycles. Again, 9,671 were able to get pregnant again. So that's great because that's a substantial portion of the population. But you can see that the adjusted fecundability ratio is 0.83, which means in those patients that had had one previous miscarriage, there's a 17% decrease in their chance of getting pregnant compared to the ones that have never had a miscarriage before. That's important because that's a huge decrease in success. If you're going from, let's say, an average of 5 to 10% per month down to somewhere between 4 to 8%, that's a big difference for people. So important numbers to have. The more interesting thing is that this is dose dependent. So if you've had 2 previous miscarriages, your chance of getting pregnant. So this isn't your chance of having another miscarriage. This is your chance of just getting pregnant within 6 months, decreased by 21%. So from 17, you're going up to 21. And if you had 3 or more, your chance went from, I think something funky happened there, Tarek. So your chance went from from the 21% up to 26%, which is how you get that 0.74. So a very significant increase in your risk of infertility or failing to conceive if you have had more and more miscarriages. So reducing the number of miscarriages is critical. And this was adjusted data where they controlled for things like your age and your body mass index and your smoking status and all of these important factors. So very, very critical data. So they then went, and we're going to go to table 4 now. And they looked at, that's table 2. Yeah, keep scrolling down to table 4. Yeah, so they then looked at what's the impact of the time to pregnancy on your risk of having a miscarriage in a subsequent pregnancy. So what they did with this was they said, if it takes you longer, meaning you are infertile, it's taking you longer to get pregnant, does that predict your chance of having a miscarriage? So their reference category was it took you less than 3 months to get pregnant. So about half of their population fell into that category. About 519 of them had miscarriages. And so they're basically looking at that as the reference. So when you look at the group that took 3 to 6 months to get pregnant, so a little bit longer, double what the reference group is, there was a non-statistically significant increase in the risk. So if you look at the unadjusted risk, it's 1.19, which means roughly a 20% increase in your risk of miscarriage in your subsequent pregnancy. Excuse me, but when they adjusted it for the miscarriage history, or not for the miscarriage history, that dropped out because your confidence interval crosses 1. So 3 to 6 months, you're still safe. When you go for 7 to 12 months, exact same thing, non-significant increase across the board. But if it took you more than 12 months to get pregnant, there was a very highly statistically significant significant increase of somewhere between 41 to 53%, depending on what they adjusted for, in your risk of having a miscarriage. So in other words, if it's taking you a really long time to get pregnant, your risk of having a miscarriage in that subsequent pregnancy is higher, meaning miscarriage can predict infertility, which they showed in table 2 that we just shared with you, but infertility can also predict miscarriage. So these two go hand in hand. And interestingly, the trend in all of these going from, for example, if you look at the far right there, from 1.15 to 1.17 to 1.41, when that's adjusting for miscarriage history, this trend of increasing rate was significant. So although those individual categories for 3 to 6 months and 7 to 11 months were not significant, the overall pattern is, which means if they had larger numbers, we would probably find significance. So for those of you who have unfortunately suffered a miscarriage, this is critical data because it does tell you you do need to be cautious in that it could predict a more significant compromise or difficulty getting pregnant. And for those of you that are struggling to get pregnant and it's taking you a long time, you also have to brace yourselves for the possibility that you may actually experience a miscarriage when you are trying. So not the most, for sure, happy data that we experience in the stuff that we do, but important because patients need to know this when they're going into it so that they're prepared for the outcome and aware of, what could happen to them when they're going through these treatments and when they're going through, the fertility journey. So I hope you guys get some information from that that's useful. We're going to flip back to the question and answer part of the show, but is it true or false, a fact or fiction that your infertility predicts miscarriage and that miscarriage can predict infertility? It's actually true. Miscarriage can predict infertility and infertility can predict miscarriages to some extent. So, make sure that you have people that are watching every single aspect of your care and make sure you're doing everything you can to minimize your risks of miscarriage, because that is something that is potentially modifiable. Healthy diet, healthy weight, avoiding, substance exposures like smoking, drinking, drug use, staying on all your vitamins, using your supplements. A lot of this stuff can have a positive benefit and a bearing on how things are going.